plow through healthcare reform. You might be able to get it done, but there are some moderate Democrats who say, hold on one second, we got the midterm elections next year. Where do you stand on this?
Well, it's clear, Alexis, we need to get something done. Despite the efforts of a number of people out there, the reality is that the status quo does not work. It doesn't work for businesses. It doesn't work for the federal budget, the state budget, municipal budgets. So we must get something done. And, of course, what we're talking about right now is what that looks like. And that's fine. This has been a very interesting month in terms of really loud and aggressive public discussion, but that's what democracy is about. So, look, each and every one of us would prefer to get a bipartisan bill here done. This kind of magnitude it would be good to have bipartisanship. But the reality is that we have not seen much in the way of sort of constructive engagement on the other side. To some extent, they're hoping to derail reform as a way of striking a very severe political blow to the president and to the majority. And that politics should not enter into an issue as important as this one.
Congressman Himes, yeah, go ahead. No problem, Patrick. Go ahead. Yours.
Well, Congressman, we all agree something should be done, but what if the problem now that we're all reacting to is a problem that was created by past congressional action? Should we really be quick to take that, to have more of that action? Maybe we should take a different direction.
This isn't by any stretch of the imagination a problem created by Congress. This is a problem created by the fact that healthcare inflation has been growing at 10, 11, 12% a year. So we've got the very highest costs on the planet, which has nothing at all to do with the United States Congress, and with the fact that we don't have a system that offers some form of coverage to every American. Those two things are unacceptable in the United States of America and have absolutely nothing to do with the U.S. Congress.
Yeah, but Congressman McCotter... Go ahead, Patrick.
Go ahead. Well, it isn't a result of incentives and institutions that Congress has created over the last 50 years. You've washed your hands of that. You're saying the current health care crisis has nothing to do with what Congress has done since World War II?
The current health care crisis has everything to do with the fact that we have a terribly unhealthy population. We have an obesity epidemic, which costs us an immense amount of money. Why? Because the system is structured not to keep Americans healthy, but to fix Americans when they're broken. That's where the incentives lie.
Who structured the system that way?
No, that's simply not true. That's simply not true. Look, underlying this is not congressional action, except for the fact that people are into Congress every single day saying, I want my Medicare to cover this, I want my Medicare to cover that. Congress does respond to that. But to point at Congress as the reason for the problems in the American healthcare system is just absurd on the face of it.
Congressman McCotter, Medicare is the costliest program and the one that could put us in the most fragile of states. And oh, by the way, many people suggest it's Medicare that is causing prices to escalate.
Well, fundamentally, Alexis, I would disagree with Congressman Himes. I mean, to say that Congress has done nothing wrong, it is the fault of the American people, and that seniors tend to get too much in terms of benefits from Congress strikes me as a bit odd and less than exact in terms of what's happened over the course of time since World War II. But in terms of Medicare and Medicaid, you're looking at unfunded liabilities in the trillions over time. And it seems to me that if we rush to judgment, as the administration and many in Congress wish to do prior to the August recess, pass a bill that had not had time to be viewed by the American public, would be to strain credulity that you can create a third government-run health care system that would fare any better than the other two, let alone fix the problems inherent in them.
Congressman Himes?
Well, Congressman McCotter has completely misstated the point I was trying to make, which is that if you look for the reason for the underlying increases in costs, and by the way, he's absolutely right about the challenges that Medicare faces. It's not about seniors getting too much, but he, like me, every single day has people coming into his office saying, we need to add this benefit, we need to add that benefit, and hey, you know what? We as representatives respond to that. Sometimes it's hard to say no, but you cannot get away from the fact that the fundamental problem here is that we have a system that is set up to pay each and every provider by the therapies that they put forward, by the diagnoses they make. Nobody gets paid for keeping Americans healthy, and consequently we have one of the most unhealthy populations in the developed world. Right there is the reason for huge cost inflation. Is Congress and the government irrelevant?
But Congressman Himes, what about things like selling insurance across state borders? I mean, aren't there things that we could do which would be simple fixes to create more competition and drive costs down that aren't even in the House bill as we speak?
Absolutely, and we should be looking at each and every one of those things. You know, one of the things I got out of my town hall meetings was that as an idea. We should be looking at everything, including the possibility of finding ways to create more competition in very uncompetitive insurance markets through the possibility of a public option. Everything ought to be on the table, and I think it's wrong for the minority to say, no, I'm sorry, we're not even going to consider the following things, because we should have absolutely everything on the table. This problem is that important.
Alexis, if I can, that is demonstrably false. The Republican Party's put forward proposals, including selling insurance across state lines, including association health plans that allow small employers to pool together to leverage insurance companies, including health savings account, including tort reform, which we believe has to be an essential ingredient in any health care package. So I think that if he's willing to work with us, so are we. But the public option is designed to become the only option over time, and that is not what's in the best interest of the American people.
All right.
Alexis, that statement is actually patently false. If anybody reads the bill, they'll see
read the bill, Jim.
That
read
the public.
The bill.
I have read the bill, Congressman, and I will tell you that it is,
and read about what's going to happen.
All
and
right,
look at what you passed in the stimulus bill too, with the Comparative Effectiveness Research
Gentlemen,
Council.
we have to leave it here. My apologies. I wish we could continue the conversation.